Welcome to our exploration of patient-centered outcomes, a concept that has become increasingly important in modern healthcare. Patient-centered outcomes focus on what truly matters to patients, going beyond traditional clinical measures to include quality of life, satisfaction, and personal goals. In this video, we'll take a deep dive into what patient-centered outcomes mean, why they matter, and how they shape the way care is delivered. By the end, you'll have a clear understanding of how this approach transforms healthcare for both patients and providers. Patient-centered outcomes are results of healthcare that reflect the preferences, needs, and values of patients. Unlike traditional outcomes, which might focus on lab results or survival rates, patient-centered outcomes consider aspects like pain management, emotional well-being, and the ability to perform daily activities. This shift recognizes that each patient is unique, and what's important to one person may differ for another. By prioritizing these outcomes, healthcare providers can deliver care that is more meaningful and relevant to the individual. Focusing on patient-centered outcomes leads to better patient satisfaction and improved health results. When care is tailored to what patients value most, they are more likely to engage in their treatment plans and follow medical advice. This approach also helps build trust between patients and providers, fostering a collaborative relationship. Ultimately, patient-centered outcomes ensure that healthcare is not just about treating diseases, but about supporting people in living their best lives. Additional healthcare outcomes often focus on measurable clinical indicators such as blood pressure, cholesterol levels, or survival rates. While these are important, they don't always capture the full picture of a patient's experience. Patient-centered outcomes, on the other hand, include factors like comfort, independence, and emotional health. This broader perspective helps ensure that care addresses the whole person, not just the disease. Let's look at some examples of patient-centered outcomes. For someone recovering from surgery, being able to return to work or enjoy hobbies might be more important than just a clean surgical site. For a person with chronic illness, managing pain and maintaining independence could be top priorities. These examples show how patient-centered outcomes are tailored to individual goals and lifestyles, making care more relevant and effective. Effective communication is at the heart of patient-centered outcomes. Healthcare providers must listen carefully to patients, understand their concerns, and involve them in decision-making. This two-way dialogue ensures that care plans reflect what matters most to each individual. Open communication also helps patients feel respected and valued, which can improve their overall experience and outcomes. Shared decision-making is a key component of patient-centered care. It involves patients and providers working together to make choices about treatment options. By discussing risks, benefits, and personal preferences, patients can make informed decisions that align with their goals. This collaborative approach empowers patients and leads to better satisfaction with care. Measuring patient-centered outcomes can be challenging, as they often involve subjective experiences like pain or quality of life. Tools such as patient surveys, interviews, and standardized questionnaires are commonly used to gather this information. By systematically collecting patient feedback, healthcare providers can assess whether care is truly meeting patients' needs and make improvements where necessary. Patient-reported outcome measures, PROMs, are tools that allow patients to report on their own health status, symptoms, and quality of life. These measures provide valuable insights that might not be captured through clinical tests alone. PROMs help ensure that the patient's voice is central in evaluating the effectiveness of care and guiding future treatment decisions. Family members often play a significant role in a patient's care and recovery. Incorporating their perspectives can provide a more complete understanding of the patient's needs and preferences. By involving families in care planning and outcome assessment, healthcare teams can create more supportive and effective care environments. Cultural beliefs and values can greatly influence what outcomes are important to patients. Healthcare providers must be sensitive to cultural differences and ensure that care plans respect each patient's background. This cultural sensitivity helps build trust and ensures that patient-centered outcomes are truly meaningful for diverse populations. Despite the benefits, there are barriers to implementing patient-centered outcomes. Time constraints, lack of resources, and communication challenges can make it difficult for providers to fully understand and address patient preferences. Recognizing these barriers is the first step toward finding solutions and ensuring that care remains focused on what matters most to patients. Overcome barriers to patient-centered outcomes, healthcare organizations can invest in staff training, improve communication systems, and allocate resources more effectively. Encouraging a culture of empathy and respect also helps providers better understand and respond to patient needs. These efforts can make patient-centered care a reality, even in challenging environments. Advances in technology are making it easier to collect and analyze patient-centered outcomes. Electronic health records, mobile apps, and telehealth platforms allow patients to share their experiences and preferences more easily. These tools also help providers track progress and adjust care plans in real time, leading to more responsive and personalized care. Telehealth and remote monitoring have expanded access to patient-centered care, especially for those in rural or underserved areas. Patients can now communicate with providers, report symptoms, and receive support without leaving home. This convenience helps ensure that care remains focused on the patient's needs, regardless of location. Personalized medicine tailors treatments to the unique characteristics of each patient, including their genetics, lifestyle, and preferences. This approach aligns closely with patient-centered outcomes, as it seeks to provide the most effective and meaningful care for each individual. By considering the whole person, personalized medicine enhances both clinical results and patient satisfaction. Managing chronic diseases often requires ongoing attention to patient-centered outcomes. For example, people with diabetes may prioritize maintaining energy levels and avoiding complications, while those with arthritis might focus on pain relief and mobility. By understanding these priorities, providers can develop care plans that support long-term health and well-being. Mental health is a crucial aspect of patient-centered outcomes. Addressing emotional well-being, stress management, and psychological support can significantly impact a patient's overall health. Providers who prioritize mental health help patients feel more balanced and capable of managing their physical conditions as well. In palliative and end-of-life care, patient-centered outcomes become especially important. Patients may prioritize comfort, dignity, and spending time with loved ones over aggressive treatments. By respecting these wishes, providers can help patients and families navigate difficult decisions with compassion and understanding. Rehabilitation and recovery programs are most successful when they focus on patient-centered outcomes. For example, regaining independence, returning to work, or participating in favorite activities can be key goals for patients. Providers who understand and support these goals can help patients achieve meaningful progress and a better quality of life. Patient satisfaction surveys are a valuable tool for measuring patient-centered outcomes. These surveys ask patients about their experiences, including communication with providers, involvement in decision-making, and overall satisfaction with care. The feedback collected helps organizations identify areas for improvement and celebrate successes. Quality of life assessments go beyond physical health to evaluate emotional, social, and functional well-being. These assessments help providers understand how illness or treatment affects a patient's daily life. By addressing quality of life, healthcare teams can offer more comprehensive and supportive care. Nurses play a vital role in achieving patient-centered outcomes. They often spend the most time with patients, providing care, education, and emotional support. By building strong relationships and advocating for patient needs, nurses help ensure that care is truly centered on the individual. Physicians are essential in guiding patient-centered care. By listening to patients, explaining options, and involving them in decisions, doctors can help ensure that care aligns with each person's goals. This partnership leads to better outcomes and greater satisfaction for both patients and providers. Allied health professionals such as physical therapists, dietitians, and social workers contribute significantly to patient-centered outcomes. Their expertise helps address a wide range of needs, from mobility and nutrition to emotional and social support. By working as part of a team, they help deliver holistic care that supports every aspect of a patient's well-being. Patient advocacy is about empowering individuals to take an active role in their own care. Advocates help patients understand their rights, navigate the healthcare system, and make informed choices. This empowerment leads to greater confidence, better health outcomes, and a stronger sense of control over one's health journey. Education is key to engaging patients in their own care. When patients understand their conditions and treatment options, they are more likely to participate actively and make decisions that align with their values. Educational resources, workshops, and one-on-one counseling all play a role in supporting patient engagement. Collecting and acting on patient feedback is essential for continuous improvement in healthcare. By listening to patients' experiences and suggestions, organizations can identify areas for change and enhance the quality of care. This ongoing process ensures that patient-centered outcomes remain a top priority. Patient safety is closely linked to patient-centered outcomes. Safe care practices such as preventing infections and reducing errors help protect patients and support positive results. By prioritizing safety, healthcare teams demonstrate their commitment to the well-being of every individual. Health equity means ensuring that all patients have access to the care and resources they need, regardless of background or circumstances. Addressing disparities in healthcare is essential for achieving patient-centered outcomes. By promoting equity, providers help ensure that every patient can achieve their best possible health. Community involvement can enhance patient-centered outcomes by providing additional support and resources. Community organizations, support groups, and local services all play a role in helping patients manage their health and achieve their goals. By working together, communities and healthcare providers can create a stronger network of care. In pediatric care, patient-centered outcomes often involve both the child and their family. Providers must consider the child's developmental needs, comfort, and emotional well-being, as well as the family's concerns and goals. This approach helps ensure that care supports healthy growth and development for young patients. For older adults, patient-centered outcomes may focus on maintaining independence, managing chronic conditions, and preserving quality of life. Providers must be attentive to the unique needs of geriatric patients, including mobility, cognitive health, and social support. Tailoring care to these priorities helps older adults live with dignity and comfort. In surgical care, patient-centered outcomes might include pain control, quick recovery, and returning to normal activities. Surgeons and care teams work closely with patients to set realistic goals and monitor progress. By focusing on what matters most to each patient, surgical teams can improve both clinical and personal results. For cancer patients, patient-centered outcomes may include managing side effects, maintaining hope, and achieving personal milestones. Oncology teams work with patients to understand their goals and provide support throughout treatment. This approach helps patients feel more in control and supported during a challenging time. Primary care providers are often the first point of contact for patients and play a crucial role in patient-centered outcomes. By building long-term relationships, understanding patient histories, and coordinating care, primary care teams help ensure that each patient's needs and preferences are addressed over time. In emergency care, patient-centered outcomes might focus on rapid relief of symptoms, clear communication, and emotional support during stressful situations. Emergency teams must act quickly while still considering the patient's preferences and concerns. This balance helps ensure that care is both effective and compassionate. Rehabilitation programs are most effective when they focus on patient-centered outcomes like regaining function, independence, and confidence. Therapists work with patients to set achievable goals and track progress, ensuring that each step supports the patient's personal recovery journey. In mental health care, patient-centered outcomes might include symptom reduction, improved coping skills, and enhanced relationships. Providers collaborate with patients to identify goals and develop personalized treatment plans. This approach helps patients achieve meaningful progress and a better quality of life. Preventive care focuses on keeping patients healthy and preventing illness before it starts. Patient-centered outcomes in this area might include maintaining energy, avoiding disease, and supporting healthy habits. By working with patients to set preventive goals, providers help ensure long-term health and well-being. For patients living with chronic pain, outcomes like pain relief, improved function, and emotional support are often top priorities. Providers must work closely with patients to find effective strategies and support their daily lives. This patient-centered approach helps improve both physical and emotional well-being. Patients with rare diseases often face unique challenges and uncertainties. Patient-centered outcomes in this context might include access to information, emotional support, and participation in research. Providers who listen and respond to these needs can make a significant difference in the lives of patients and their families. Evaluating the success of patient-centered outcomes involves looking at both clinical results and patient experiences. Providers use a combination of data, feedback, and personal stories to assess whether care is meeting patient goals. This comprehensive evaluation helps drive ongoing improvement and ensures that care remains focused on what matters most. Future of patient-centered outcomes looks promising, with continued advances in technology, research, and care delivery. As healthcare becomes more personalized and responsive, patients will have greater opportunities to shape their own care journeys. By staying focused on what matters most to patients, the healthcare system can continue to evolve and improve. Summary: patient-centered outcomes put the individual at the heart of healthcare. By focusing on what matters most to each patient, providers can deliver care that is more effective, satisfying, and meaningful. Whether through communication, technology, or teamwork, the commitment to patient-centered outcomes is transforming healthcare for the better. Thank you for joining us on this journey to understand and embrace patient-centered care.